Namaskar and welcome to our special series on Eye Matters Daily. Did you know that glaucoma is one of the leading causes of irreversible blindness? It is estimated to affect around millions of people in our country. And what's more concerning is that most people don't even realize they have it until significant vision loss has occurred. Today, we'll be talking to an expert to understand what glaucoma really is and why early detection is so crucial, and how you and your loved ones can take simple steps to protect your vision. So let's get started and shed some light on this silent thief of sight. Doctor, recently I've been hearing a lot about glaucoma and how it silently leads to blindness. Can you help us understand what glaucoma really is and what are the most common risk factors leading to glaucoma?
Yes, Uma. Glaucoma is called silent tip of sight because most of the glaucoma in their early stages they don't present with any symptoms. And glaucoma basically is a chronic progressive optic neuropathy. That is, an optic nerve had damage occurs. That is a nerve which connects the brain with the eye gets damaged with the high pressure most of the time, and sometimes it is even damaged without the high pressure also. And it is a chronic progressive in nature. So most common risk factors are increasing age, myopia, and steroid use for a prolonged period of time, and other systemic conditions like diabetes and hypertension, and yes, family members who have a glaucoma and their siblings. Okay.
So, if I'm diagnosed with glaucoma, what are my treatment options? And will I need surgery immediately or are there any alternatives? Also, does the treatment differ from the type or the stage at which glaucoma occurs?
Yes, for once you're diagnosed with glaucoma, there are many options. If you're diagnosed in the early stage, the first treatment options is the medical management. That is, the glaucoma is being contained by the medicines, that is eye drops, or sometimes with the oral medications. But in the later stages, when the disease is advanced, we have to go for the surgery and then sometimes with the laser treatment options. And yes, we have to manage glaucoma based on the type of the glaucoma. Like there are primary open angle glaucoma and there are primary angle closure glaucoma also. So primary angle closure glaucoma, initially to open the angle, we do some laser procedures and then slowly starts with the medication, and based on the stages of the disease. That is, if the disease most of the time it is too advanced, then we have to choose whether to go for the medical management or surgical management. So yes, we have to treat the patients based on the stage of the disease, type of the glaucoma, and yes, early management options are always medicines, then followed by surgery and laser options.
I've also read somewhere that there are certain simple signs like eye pain or increase in spectacle number that could be the early signs of detecting glaucoma. Can you help us understand these
Yes,
symptoms better?
pain, congestion, and redness and blurring of vision are rare. They are rarely present in uh, glaucomas like acute angle closure glaucoma or any other condition with acute rise of eye pressures. But most of the time, glaucoma are asymptomatic. That's why they are called silent tip of sight. And yes, regarding the changes in the spectacles are not a definitive sign of glaucoma, but that can be because of the other ocular conditions. So that has to be addressed.
Another question I wanted to address today, are there any other comorbidities like diabetes or hypertension that could lead to glaucoma? And are there any precautions that one can take?
Yes, comorbidities like diabetes and hypertension, they do really, increases the like chances of having glaucoma more, because these diseases, especially like diabetes, there is already, it affects the microvascular, supply of the optic nerve head. That is one thing. And another thing, even like hypertension in the early phase, because of the high BP, there is increased perfusion, and then yes, IOP rise and then causes glaucoma. But in later stages, it can causes normal tensions glaucoma. So basically, to avoid this, the patient should be told about to control the diabetes and then hypertensions with physical exercise and then medical treatment.
And lastly, could you address a few myths about glaucoma?
Yeah, there are certain myths about glaucoma. That is, most of the time the patient thinks that glaucoma is only, elderly age related disease, but glaucoma presents even in the childhood because of some developmental anomalies. It is basically a disease in which there is any disturbance in the outflow system. And another things, the myths they have is, if the patients are asymptomatic, they think their eye is healthy. It's not like that, because glaucoma is a silent taper. This is silent tape of sight. And then another thing, what a patient tend to have this myths is this: once they started medicines, once they have given a drop, the glaucoma is treated. It's not like that. Glaucoma is a lifelong disease, and it's need to be treated lifelong and has to keep on following up routinely when their doctors comes for eye checkup. And it has to be, titled based on the stage of the disease, type of the glaucoma, and everything. And the patient needs to be counseled that their visions, they're not going to improve, because in glaucoma, once the disease is diagnosed, the treatment is to preserve the vision, not to improve the vision.
Well, we hope this conversation has helped you understand glaucoma a little better and why regular eye checkups are so important. Remember, early detection can make all the difference in protecting your vision and your loved one's eyesight. Share this episode with your family and friends. Let's spread awareness about glaucoma. Until next time, take care of your eyes and stay healthy. For more information, follow us on @imattersdaily. Thank you.